Hi everyone and welcome back to Learn Neuroradiology. I'm Brent Weinberg. Today we're going to be doing case 2 of the brain imaging capstone course. We're going to be going through some interactive images together and going through the explanation together. So be sure to follow along and let's jump right in. So the interactive cases we've shown on a couple of the other videos. You can find them by going to learnneuroradiology.com/braincapstone or bit.ly/braincapstone. We'll drop those links in the description below so you can check those out if you want to. If you want to go ahead and go to those, do that now. But now we're going to go ahead and get started with the case. So case number 2 is going to be a 60-year-old man who's having personality changes, lack of motivation, and a flat affect for the past couple of months. So without further ado, let's take a look at the images. So here we are at the Learn Neuroradiology website, which you can get to by following those links. If you want to find the whole course, you can go here to the brain imaging link. We're going to go ahead and scroll down to case number 2. Here's that 60-year-old with personality changes. There's a brain MRI, which we're going to get to by clicking here. That's going to open brain MRI in our browser window here. Now here we can see a variety of MR images that you might have for a typical case. We've got diffusion, FLAIR, T2, blood sensitive or susceptibility weighted imaging here. Some pre-contrast T1 on the bottom left and post-contrast T1 on the bottom right. Here you can kind of see right away this is not a normal case. We're going to start by, we're going to double click this FLAIR just to make it bigger here so we can see kind of what's going on. As I come up from the top, I see there's clearly an abnormality in the frontal lobe. The inferior frontal lobe here is swollen on the right, also abnormal on the left. It's T2 hyperintense, the FLAIR abnormality. The geno of the corpus callosum is expanded and there's some mass effect there. There's kind of mass effect extending into the body of the corpus callosum here with some mass effect on the frontal horns of the lateral ventricles here. So there's definitely some mass effect. I'm worried there's an underlying mass. Looks like it mostly spares the cortex and it's not in a vascular distribution, which is important. Let's go back and see what else we have. On our T2, we have some areas which are very T2 hyperintense. Again, we see those areas of mass-like expansion across the corpus callosum and definitely abnormal T2 hyperintensity here. On our susceptibility weighted imaging, we can see there are areas of hypointensity here or susceptibility effect in some of those nodular areas. Those are probably areas of hemorrhage that we should be concerned about. So maybe we have areas of hemorrhage and an area of mass effect and mass. So I'm concerned that there's an underlying mass. On diffusion, we have an area that's diffusion bright, so it's abnormally bright here in the areas of FLAIR abnormality. That's probably areas of dense cellularity. So all things are kind of pointing towards a highly cellular tumor. This is a very concerning set of images. On our pre and post contrast here, we see the same findings, except centrally within here, we have a nodular area of peripheral enhancement, central necrosis, with some additional areas of nodular enhancement, so kind of multifocal enhancement in all of those areas of abnormal swelling and abnormal FLAIR. And you see the same thing. This is just a coronal reformat of those same images, multifocal abnormal enhancement along the margins of the corpus callosum and extending into the frontal lobe. So we have a mass here with abnormal T2 hyperintensity and abnormal enhancement, kind of multifocal and crossing the corpus callosum. So let's take a look at a little bit of a summary here. Now here's a CT image, which I didn't have the interactive portion. You just confirm the findings that you saw. Expansion of the corpus callosum here, mass-like expansion of the frontal lobes, mass effect on the frontal horns. So we're worried that there's a mass there. Again, FLAIR hyperintensity, kind of a nodular area of a mass, abnormal diffusion, abnormal ADC as well, which kind of wasn't in the interactive session. Here you see that area of susceptibility that we pointed out. That's probably blood products, probably in the middle of that most nodular looking area. And again, nodular areas, very heterogeneous on T2. And when we put the pre and post contrast together, you can see those nodular areas are clearly enhancing. So we have an enhancing mass in the frontal lobe, very aggressive looking, a lot of aggressive features there. So we've got mass effect, FLAIR hyperintensity, diffusion abnormality, kind of all of those things. So this just sort of summarizes the findings that you see there. So our question here is, what imaging characteristics make this seem like a tumor that's a higher grade tumor? And so the things that we saw are central necrosis, that nodular line of enhancement, the multifocal enhancement, abnormal diffusion makes you think that's very cellular, and it also crosses the midline and through the corpus callosum. So we're thinking this is a high-grade tumor, probably a glioblastoma. All right, and so like I said, this is a glioblastoma. This is a grade 4 astrocytoma, mostly presents in older adults, can present with altered mental status. In this case, a patient was having personality issues because it's in the frontal lobe. They've gotten rid of glioblastoma multiforme, so they just call it glioblastoma or GBM now. Very poor survival. The imaging findings we've all seen, okay, abnormal diffusion, enhancement. They try to resect these and treat them with radiation, so it's a multifocal therapy is required to treat these. This is a typical imaging appearance of a glioblastoma, one of the couple of things which crosses the corpus callosum, including lymphoma, occasionally demyelinating disease, but glioblastoma and lymphoma are the kind of things crossing the corpus callosum that you should be thinking about. So thanks for tuning into this video, seeing this glioblastoma case. We're going to have additional videos coming up in the upcoming weeks. Be sure to check out the interactive stuff on learnneuroRadiology.com/braincapstone, and be sure to like and subscribe to the channel.